That feels better, yeah.
I'm starting a new ASMR series, so if you like this type of content, make sure to subscribe so you don't miss out.
It's good. You just want to hit that thing in the front.
Yeah,
Doesn't that thing look pretty crazy?
Yeah. It's on, like, does it rotate on its own?
Yeah. Awesome. So yeah, tell me kind of from the beginning, what's been going on with the back. It started a few weeks ago?
Yeah, probably almost maybe a month ago.
Okay.
And it wasn't even from, like, a specific thing.
Okay.
So that's why I think maybe it's, like, just overuse or, like, something like that did it.
Okay.
But, I mean, I have been skiing, like, 3 to 4 days a week.
Okay.
Pretty hard all season, like, since December, which I normally don't. Like, normally it's, like, 1 or 2 days every other week.
And is it worse with skiing or?
Yeah.
So
Yeah, like,
it's
with
like
impact. Not just,
okay.
like, if I'm just like in a neutral position and I'm just skiing, it's fine, but if I go off of any like jumps or anything.
Okay, gotcha.
And then yeah, mostly it's like if I do any kind of like pelvic tilt, it hurts. Like this, that hurts.
So when you're more into like an arch back versus here?
Both, but
So
I definitely have less mobility when I'm like this.
Okay.
But yeah, if I arch my back or like hollow it, hunch it, it hurts.
Okay.
And it's like here.
Okay, gotcha.
And it doesn't feel like it's like muscle or anything. It feels like it's like in my
deeper.
bone. Yeah.
Does that pain ever travel down the legs and glutes or anything? So it's just kind of right there. How would you describe it?
It like the onset of it is pretty sharp, but it's more like a it's kind of sharp, like.
When you get to that end, right?
Yeah, like a dull sharp.
Sure. Yeah. So when it's kind of like just got a constant dullness, but you can make it.
Yeah.
That sharp pain.
Yeah.
Okay. Cool. Any pain with coughing, sneezing, using the restroom?
Sneezing. Sneezing.
So you have noticed that?
Yeah.
Okay.
Coughing doesn't really do it. And then also my roommate who's a PTA, she like said my hips were really uneven.
Okay.
And she like did something where she put her arm like between my legs and like squished them together and whatever. And apparently they're less uneven.
You're all even out?
I don't know.
Let me just take this from you. Cool. Yeah, we're gonna look at all of that stuff and kind of. I can already tell what it is based off history. It sounds like a disc injury, but we're gonna do a few tests to kind of confirm that. We can do a lot of things before imaging to kind of rule things out. Blood pressure is usually pretty good.
Yeah, I've had issues with like mild hypertension in the past, but.
Cool. You're perfect. Is 1/8/72.
Cool.
And then, do you have a medical doctor that you see?
Not really.
Okay, just kind of when things pop up.
Yeah.
Gotcha. All right. Cool. So while we have you sitting there, let's go ahead and scoot back onto the seat. Just kind of square up there. That's perfect. And then if you kick out that left leg and pull the toes back towards you, does that aggravate anything back there? Okay, so holding the toes back, if you bring your chin down to your chest, and then if you do that big slouch.
Yeah, it's like right there.
Would you say that that's worse than when you drop that down into your slouch?
This is worse.
It's about the same. And then same thing on this right side. And chin down and tuck.
That's fine. Yeah, it's just like when I kind of slouch over.
Okay, cool. Let's go ahead and stand up, run through some ranges. If you face me, bring your feet together. So take the right hand, just slide it down the pant right there. Any pain, pinching, or tightness with that? And then same thing to the other side. And then if we rotate it all the way over towards one side, can you bend backwards from there?
It hurts like there.
On the right side?
On my spine.
Just right in the middle?
Yeah.
Okay. And same thing.
Yeah, like pretty much same thing on my spine there.
Okay. And then if we just kind of slowly run down, touch the toes, I'm gonna look down the back.
Like here is what
That's where you're feeling it
hurting.
already?
Yeah.
Okay. And you can see that right side's a little bit more lifted. That's probably that rotation that your roommate was talking about.
Mm-hmm.
And then if we take the hands here, put the belly out.
Yeah, it hurts like there.
Okay, cool. Let's go ahead and go into your back. And so you're skiing, you said?
Yeah, skiing, and I mean, obviously I haven't been doing like a ton of acro, but
Yeah.
I definitely felt worse. Like, Will and I did like 3 hours
I
of
saw
like
that.
pretty intense acro.
Okay.
And
Pinching in the hips there, that'll feel
yeah,
pretty
that's
good.
good. And then after that, like I was like, okay, I need to see somebody.
So that really aggravated it?
Yeah.
Okay.
But honestly, doing like in the moment, it wasn't too bad. It was like after once I had like settled,
Mm-hmm.
like I didn't have to stop the session because my back hurt.
Okay.
It was just like afterwards, I was like, damn.
All that stuff feels pretty good.
Mhm.
This feels like stretches?
Yeah.
Okay. So it's super flexible in the hips. Whenever I'm looking at low back stuff, I always want to check out the hips to
Mhm.
see if that's maybe where it's coming from.
My hips are like crazy
You have
flexible.
like no restrictions.
Yeah. And they crack a lot and pop like when I'm in like butterfly and stuff.
Okay. Yeah, this is definitely not where it's coming from, so, which is great. So a lot of times, what I'm checking for is sciatic nerve
Mhm.
tension. A lot of times you'll feel stuff behind the knees or into the glutes, and that will, if there's any type of tightness in the low back, it'll actually kind of show into the legs.
Mhm.
So that stuff all looks pretty good. Let's go ahead and go face down. All right.
So I put my face in here.
Yeah, you're perfect right there.
I have mild scoliosis,
Okay.
but I've never been like treated for it.
So we can kind of see the rotation. See when I push this leg and how the whole low back moves
Mhm.
versus this side.
And this one like touches my butt, and the other one doesn't.
Yeah, so that's pretty normal for you.
Mhm.
You've noticed.
I'm not sure, but
Okay.
I just noticed that now.
And your scoliosis, you have X-rays.
No.
Okay.
Like a pediatrician when I was like 14 told me.
Yeah, we've got. Do you feel a little bit more tenderness on
On
this
the
side?
left, yeah.
Okay. So with scoliosis, typically we'll have it in the thoracic spine. We'll have it curved this way.
Mhm.
And the lumbar spine is typically coming out this way. And so we can kind of see if she's rotated this way, the tissue is going to lift up a little bit more. I don't know if we'll be able to see it on camera, but that's basically what I was looking at when you ran down to touch your toes.
Mhm.
We can kind of see down the back that little difference there. So pushing in through here, no pain when I'm pressing in,
Mm-mm.
and all that stuff feels pretty good.
Mhm.
Okay. Cool. Let's go ahead and take the hands right here, both sides. Go ahead and push up the upper body, leaving this on the ground. Does that aggravate anything?
Not really, but if my hands were at the level of my hips, then I pressed up, it
Go
would.
ahead and try that.
Yeah. It's not as bad as just doing it from standing,
Okay.
but it definitely, like, I feel it in that low
Okay.
spot.
Cool. So kind of keep this in mind. We're going to recheck this at the end. You can go ahead and sit on up. So what I'm thinking is a disc injury, which is very, very common, especially kind of within our age group. Those discs are really mobile. So basically anytime you're coming out of a neutral position, you're getting that aggravation, kind of that dull, achy sharpness.
Yeah.
I guess all of the words.
Yeah.
So we have these discs, they sit in between the vertebrae, and those help to kind of limit and support our movement. Sometimes if we get overuse, so too much motion going into the spine, versus using our hips for that motion, we get kind of overuse and they can get damaged and kind of press onto those nerves and create that. So I like this model here. It's kind of a blown up version of it, but let's just kind of take this motion for example. So when you kind of flex forward, that's what we were doing here. It puts a lot of pressure onto the front of the disc, and it will allow, this would be an extreme example, but a full-on herniation to kind of click onto that nerve. So you probably have some degree of that. We'd be able to tell exactly what was going on if we got an MRI. it's not usually my first starting point because you can do a lot of things conservatively. However, if it's something that's not responding after like 2-3 months, then that's when I'd want to look at imaging to see if there's anything more going on with it. So the two big things are hip mobility and core stability, so that we're not getting too much movement going on in the lumbar spine. I'm going to run through, so even though you have extremely flexible hips, that flexibility may not be translating into, you using it with your skiing or acrobatics, things like that. So there's some movements that we can do to get some more activation through there. Core stability is going to be put on you. Are you doing workouts?
Yeah, I mean, honestly, like the only thing I really do is like core and glutes. So.
Okay, and then your core stuff, is that like in a neutral position or?
It hasn't really been. It's been a lot of like crunches and stuff.
Okay.
But I kind of have stopped doing that since my back.
Cool. Yeah, I'd say probably cut those out for life and just do neutral stuff. I think they actually took it out of the military too, sit-ups, because they have been associated with creating disc herniations. Because it is an overuse of flexion. And spine's not really designed for too much of that. So, trying to avoid like V-ups, like toe to bar type stuff, or full-on sit-ups. Crunches should be fine, and things like that. And you do a lot. I mean, skiing in itself and acrobatics in itself is really good core work. So today I'm going to run through adjustments, kind of do a few things, and then we're going to recheck those motions, make sure it feels really good. If it does feel good, then we're just going to reinforce that with movement, things that you're going to do on your own. And so you've seen my chiropractic videos, but never been adjusted.
Yeah.
Any apprehension towards it?
I mean, not really. I mean, I'm a little like
nervous,
I guess, but no, not really.
Okay, so I'll walk you through it. It's not too scary.
Okay. Do they like hurt when?
It shouldn't.
Okay.
And I go really gentle. Sometimes we are working in areas of pain, and so because we're working in an area of pain, it can be a little bit painful. Yeah. But not necessarily the intention and not the majority of the outcomes.
Okay.
So, let's get started with it. I'll have you go face down. I know I've been missing the acrobatics community.
Yeah. I know, it's like not the same. To get together with like one person.
Where did you and Will go the other day? That looked like y'all were in a gym.
Yeah, we went to Vasa.
Okay. So real quick, this is just a little bit of traction. Are you doing okay with that pressure there?
Yeah, that feels good actually.
Okay. Yeah, so with discs, if they're kind of poking out there, this creates a negative force for it. It kind of sucks it back into place. So things like traction table, or those tables that you kind of hang upside down on, this is a similar effect to that. But yeah, it looked like y'all were in a gym.
Yeah, it was just like a straight up, like, normal gym.
I'm sure y'all had a big audience.
Yeah, we had some fans.
I need to get with Will and have him throw me up in the air.
Yeah. He lives up here now. Well, not in Thornton, but he lives in North Arvada.
Oh yeah, I forgot that he moved.
With Casey.
Yeah.
You know Casey?
She
used to live in Pueblo.
Okay.
So I feel like she was already down there by the time he kind of got into acro.
Okay.
But they have like a kind of little acro house going over there, which is cool.
Yeah, because he used to live next to me. So I'm going to do a little bit of pressure on this left side. So this is where you've got that little curvature and that differentiation of quad tension. So we're going to run through this stuff and then we'll recheck and see if that heel gets to your butt a little bit easier. And that's not like a huge thing. Like if you came in and your hips were like that, I wouldn't be like, oh, like you need a heel lift, you need,
to like fix it.
You're all rotated. Yeah, that's just kind of the way that your body is working around that little scoliosis. And pretty much everybody has some type of rotation in there. But if it feels better afterwards, we may want to keep up with some of these things. Do you mind if I press into the side here? Okay. So I like doing the soft tissue before we get into the adjustments, just makes everything go a little bit smoother. And you're doing okay with that pressure? Cool. I was going to say we should try to get it hand to hand, but I know that's one of the things that's bothering me. That'll be our pre and post check. I guess
Yeah.
we'll do it before. These are the French fry socks.
Yeah.
So real quick, do you feel the difference there?
Not really.
You don't have to.
Where's my butt? On my left side. Okay.
So I guess they're easier.
Yeah, it was easier on the left side.
So that's all kind of like a functional leg length difference. Let's go ahead. I'm gonna have you face me on this side here.
Side.
Yeah. And then I'm gonna move you around a little bit. Are you comfortable lying on your side?
Like this?
Yeah.
Yeah.
Okay. Cool. So we already got a little
Okay.
pop in there.
Yeah.
For this one, I'm gonna go into the SI joint, so a little roll and a push there.
Ooh.
So super easy.
Yeah.
That felt pretty good?
Uh-huh.
Let's go ahead and flip that way. That microphone's about to die.
Oh, shit.
Cool. So we're gonna come up a little bit higher into lumbars here.
Whoa.
Awesome. That felt pretty good?
Uh-huh.
Great. Let's go ahead and sit on up. And you can keep your legs where they are. And then I'm gonna have you bring your hands like that and around the head. If you slouch, does that aggravate the back?
Mm-hmm.
Okay, let's go onto your back then. We're gonna do it a little bit different. So I'm gonna do a little push right above that area we adjusted. Can you bring your chin to your chest? Good. And more let that air out.
That was a really quiet one.
And I'm gonna come through it a little bit different way in a minute.
Good.
So coming into the neck, no, you're perfect right there. Whenever I'm looking at spinal stuff, I'm always gonna go into the neck as well.
Mhm.
Just because we have neural tension throughout the whole body, so even though it may not be directly in there, we can get a percentage of help by adjusting the neck. Any apprehension towards that?
Mm-mm. My neck has been, like, just the last day or two, like, turning my head this way has been kind of stiff.
Okay.
I don't know, just from sleeping weird, probably.
And do you feel that stiffness on this right side?
It's
too?
like on this side,
Okay.
kind of.
So you can go ahead and just relax back. That microphone might die. I should have charged
That's
it.
the important
I know.
stuff.
So are you feeling more of that tenderness on the left side?
Mm-hmm.
Do you get headaches at all?
Not really.
Are you doing okay with
Mhm.
that pressure? So when I just kind of take you over towards this side, no pain or anything with that.
Mm-hmm. That's good.
Okay. So I'm gonna kind of feel into that joint that's locked up. So we're kind of right here,
Mm-hmm.
not moving as well. So I'm gonna do a little push through there.
Whoa. Whoa. That was crazy.
Such a good reaction. That felt okay?
Yeah.
Just a little startling.
Uh-huh.
Okay.
Yeah, it didn't hurt. It was just...
Good. So try to relax that muscle right there. Perfect. And same deal, a little push.
Whoa.
Good. Yeah, the neck's usually a little bit crazier just because
Yeah,
your
you
ears are
hear
right
it in
there.
your ears.
Let's go face down one more time.
That's crazy. Don't snap my neck off.
Yeah. Hollywood has made that a really scary thing. Alright. Cool. So I'm gonna do a little push right here. I'm gonna have you take a big breath in, let that all the way out. Good. Awesome. And then let's go ahead and pop up onto the hands how you were in the beginning.
Just like here?
You can take them up here as well. It's okay if there's no big changes with that.
That feels better, yeah.
A little bit easier to get into that
Mhm.
position. Okay. Cool. Let's go face down real quick. I keep looking looking at that microphone and I'm like trying to rush through the treatment. So I have this little instrument here if you want to look at. Looks really scary. Basically just going to be scraping it onto the skin. I have some emollient so that it doesn't.
Okay.
Do you mind if I lift the shirt up to here?
Yeah, I have like another one over there.
That's perfect. So I like this just as a nice little reset for the tissues here. And are you doing okay with that pressure? Cool. Cool, so we've already seen some differences. So the way I adjusted you was into extension, which is kind of that press up. So making that a little bit easier. So when you leave here, I'm going to have you continue to do those movements. To make sure that everything we do in here stays a little bit longer. And then we're going to look into some hip stuff as well. Still doing okay with pressure?
Yeah, that side feels really good actually.
And so this is the side that was a little bit more lifted.
Yeah, that side's more tender for sure.
Are you familiar with kineseotape?
Yeah, I've never really used it, so I guess no, but I like know what it is.
Okay. I'm going to do some tape with you. The reason I like it for this type of injury is, right, every time you come out of neutral position, you feel it in your low back. So if we tape you in a neutral position, that little stretch will give you some feedback.
Just like remind me.
Yeah. Do you have a color preference? You got these over here?
Blue.
Blue? Cool. Alright. So are you working out on a pretty regular basis? Kind of slowed it down since.
Yeah, I slowed it down, but I mean, I guess less than I normally do, but my normal before was probably not normal.
Okay.
So, yeah, I mean, I still ski, you know, like, I was just in Jackson for like 7 days, so I skied
They just
there.
got some crazy
Yeah,
stuff.
it was insane.
We'll do a little bit of cold spray coming at you. 3, 2, 1. You didn't even flinch. Usually in the mornings it's like outside temperature alcohol spray. I'm gonna switch sides. This is like my side of the table. Cool, so this tape's good if you want to hold it on for about 5 days or so. I'm kind of like a 2 to 3 day person. If you feel any irritation, feel free to take it off.
Is it waterproof?
It is waterproof.
Oh, cool.
Let's check this up. We're gonna redo this. Sorry. I need to get more spray on here. Alright, coming at you 3, 2, 1. Yeah, so it's good in the swimming pool, good in the shower.
Okay. Just don't like scrub it, I guess.
Yeah, and actually you probably don't take it off in the shower.
Okay.
Because it heats up the glue and actually it gets a little bit harder to do. That was the mistake that I made at the, when I took this seminar. I regret not shaving my legs.
Oh, yeah.
Every guy was sitting in the hot tub trying to take this stuff off.
That's probably like the worst place to do.
Yeah.
Hairy legs and hot tub.
It's a good learning experience. Alright, let's try that again. Perfect. New back. Let's go ahead and try that press up again. Any differences?
It doesn't hurt as much, like it doesn't feel like there's as much tension back there, yeah.
Okay, perfect. So as far as treatment goes today, we're going to keep it with that. I'm going to run through a few exercises with you to keep up with to make sure that everything gets locked in and We made it with the microphone.
When I first started doing acro and handstands really intensively, I had wrist injuries and like would have to take like months off.
Okay.
And now they're fine just because I don't do as much, but.
So we want at least 90 degrees
Mhm.
of wrist extension if we're doing handstands.
Mhm.
That's kind of the prerequisite. So you're a little bit limited.
Mhm.
I can actually show you some movements again too, but. Cool. We didn't pre and post check. But,
Mhm.
maybe we can get in the gym and do some handstands in there.
Yeah. Cool.
Just gonna run through everything. I think I popped my own elbow on that one.
My shoes are like not really on, so. Ooh. That was a good one.
Yeah, they are pretty jammed up.
Yeah.
You can feel that.
Mhm. They get really crunchy.
Elbow on this side. Making Jennifer move around.
Yeah.
Let's go ahead and sit up facing that way.
And that was a good ankle crack. This ankle I sprained like a year or two ago, and it's like never been the same. And I.
That felt pretty good.
Mhm.
A little pull up here.
Was that me?
That was you.
That I didn't even like feel that one.
Good. That was pretty easy.
Mhm.
Cool.
Huh? Oh yeah. I didn't know like what I'd have to do. Like, I don't know.
No, that's perfect. Oh, I haven't done this. You feel pretty good? Do you want to test?
Yeah. Okay.
Oh, sorry.
Okay. I'll just jump a little bit more.
No, I can throw you more.
Okay.
Yeah, I just throw you more.
Going a little mild for the first one's probably a good idea.
Good.
Don't come up your shoulders.
Sorry. Sketchy. I felt like we were so flat.
Thanks for watching. If you liked the video, do me a huge favor and click on that like button below. And if you're new to the channel, I'd love to hear your feedback. Please leave a comment below and I'll make sure to respond.